Hi, everyone, and welcome to this Resolve webinar. Our focus today is on those people who are trying to conceive during this COVID-19 pandemic. You might be somebody who has been trying to conceive for several months, and you were perhaps starting to think about seeing your doctor or maybe even seeing a fertility specialist. Maybe you've been trying for over a year and you've been reading about how to conceive and reading about your body and realizing, gosh, maybe it's time I went and saw a specialist. Maybe you've been thinking about actually seeing a specialist for a while, but you haven't quite done it. And now you may have some questions, and we have gathered experts together to do just that, answer your questions and talk about this new state of the world that we are in. Joining me today is Dr. Sigal Klipstein. Dr. Sigal, I know you like to go by that, is with Infertility. She's in Illinois. I'm very proud to say she's a part of Resolve's Physicians Council, and we are so happy to have you today. Thank you for being here.
Thank you, it's a pleasure.
Also joining me is Lori Metz. Lori is a licensed clinical social worker. She's in New York. She does a lot of work with Resolve. And I love the acronyms after her name, because I'm sure you're wondering what the BC-TMH means. And Lori, it would be great if you could share right now what that means, because it's so perfect for the kinds of work that people are doing right now.
Oh, well, thanks so much, Barb, and thanks so much for having me here today. It stands for Board Certified Telemental Health Provider.
Yeah, I mean, we're doing a lot of telehealth. So who knew there was a board certification in that? And I learned something new with that. So we're glad to also have you sharing your expertise with our audience. I just want to share about Resolve really briefly. If you have not connected with us on our social media platforms, I encourage you to do so. We have a tremendous amount of support, but also a way for you to connect and feel a part of a community. We're on Facebook and Instagram and Twitter and all of the social media channels. And we hope that you find comfort, but also connection and resources through our social media, as well as on our website. We do have special content right now for COVID-19. You can find it right from our webpage at resolve.org. So we're going to jump right in to get some tips from our experts if you've been trying to conceive and you're not sure yet how to proceed. So Dr. Klipstein, I'm going to start with you, and I want to just talk a little bit about kind of infertility in general and this particular time we're in. The people who are listening to this, who are in the process of trying to conceive, they may not even feel like they have infertility yet. No one has maybe even told them that. But maybe you could start by just sharing a little bit about your insights into this unique group of people.
Yeah, I think it's really an interesting time because you know, those individuals who might be starting to think about building a family may have maybe been trying for a few months, aren't sure if they need help or don't need help, are in this sort of time where they feel like there's uncertainty about their fertility, but then also uncertainty in every part of our lives right now. So we don't know what tomorrow brings. We don't know where COVID-19 will take us. I think a lot of concern is that, you know, even if you wanted to go out and reach out and find a doctor, how do you even start when all the rules have changed? So what I would say is you know, as I think about this, as you're trying to get pregnant and you don't know if this is going to be the month or next month's going to be the month or what will happen, will I continue the pregnancy, will everything be okay? I feel like most people don't understand that uncertainty that people going through infertility feel, and yet now as a country and as a world, we're all feeling that uncertainty, but I think it's even more compounded when you're trying to figure out the world and you're trying to figure out your fertility. What I would say, you know, in terms of this really unique time is that it feels like everything's on hold. And that's the last thing you want when you're trying to get pregnant, because you feel like every month is critical. And yet it's really it seems like we've been in this for years, but it's only been weeks really. And I want to just emphasize that a few weeks or even a few months in the vast majority of cases will not have a significant impact on the fertility journey and the chance of getting pregnant. So while I think it feels like forever, if you can step back and look at the big picture, for most individuals and couples and people trying to get pregnant, this is not going to put you back more than the couple months that we're kind of in the middle of this. And there are lots of things that you can do proactively during this time so that it doesn't feel like such a pause.
Let's talk about that because I'm all about at Resolve advocating for yourself and being proactive. This is sort of the mantra that we share with the patient community. What are some of those things that they could be doing right now?
Yeah, so of course you want to optimize your health and take your prenatal vitamins and all those things that you would do anyways. But in terms of reaching out, um, clinics are for the most part closed for routine visits. On the other hand, the vast majority of clinics are offering telehealth visits. And whether you're an established patient and maybe you just had a pregnancy test or you're just going to start a treatment or you're just kind of getting ready to make a plan, or maybe you're someone who has never contacted a fertility specialist, now is a really good time to do that because there's a lot of availability. All of us are, kind of sitting at home doing telemedicine consults, doing everything we can to make sure that we connect with our patients, both ones that already we have and new patients who need to be seen. And while we can't do treatments quite yet, we're hoping to start them, as the weeks go by and as the crisis starts to wane a little bit. We can do a lot remotely. We can make a lot of plans. We can certainly talk about the things that might be causing the infertility and really come up with a game plan of what to do as soon as we open back up again, what tests are available, what potential treatments there are. Of course, everything changes over time, both in terms of where we are with COVID and in terms of every test you have gives us more insight into what might be going on. But it's a really good time to reach out and it's a really good time to stay in touch. And we're all really available to do that. And there's actually a whole lot that can be done via telemedicine, more than any of us, I think, ever imagined. So I really encourage people to reach out.
Sounds like a great use of people's time and they can get questions answered. I mean, why not go right to the source, go to a physician and ask those questions? It may set them on a really good course. For somebody who really can't even get to see their OBGYN, are they able to get a referral from their OB to you? How does that work right now?
So a lot of it depends on which state you're in and what insurance you have. So I'll answer a little bit broadly because, of course, you have to check with your specific insurance and the conditions kind of on the ground where you are. But the OBGYNs are all open for business, so they may not be seeing elective and routine exams and so on, but they're available and the offices are open. And so I think it's really a good time to reach out and get a referral if need be. Um, there's no reason why you can't get the process started. And I think that what's important is to have a plan, right? And to have, uh, while you don't know exactly when you'll be able to move forward with that plan, just having a step-by-step ABC. First, I'll meet the doctor, then I'll do these tests, and as soon as I can, I'll call with my period and so on. I think that's very important, and the OBGYNs are really quite open to getting as much assistance to their patients as possible. So please reach out to your OBGYN at this time.
That sounds like fantastic advice and so forth. And I'm glad to hear that you are doing a lot of these new consults. So people, what you're saying is they're finding you and they're people that haven't ever even been in your office, correct?
Absolutely. And I think, people are a little bit more flexible. They're at home. Their partners are often at home. It's nice to just have meetings. And what I've actually found, which is interesting, is that people are much more relaxed and comfortable talking from home. And so I think when you come to the doctor's office, it's sort of the sterile environment. It's not the environment you're comfortable with. This way, it's more like a chat. We're kind of sitting in our living rooms. We're talking with one another. I think it's a much more relaxed environment. And I think that helps the relationship building and the comfort level with moving forward. So yes, absolutely reach out, especially during this time when we're all sitting at home, working from home. Many of us can't, do our regular jobs. Some of us obviously have to go out and work, outside of the house. But yes, please reach out. There is availability. Physicians are ready and waiting to speak with you. We're open and available, and would welcome you reaching out to us.
Thank you. And we just did a webinar on telehealth. So I encourage anybody who's listening to this to check that out, because boy, there's a lot of ways to maximize that telehealth appointment. And I encourage you to check that out. Lori, we are so glad to have you here as well. We always love to include at Resolve the mental health aspect of this family building journey. And those individuals that are out there trying to conceive, they're also have a lot of emotions and feelings right now. Can you, Lori, tell us a little bit about what you're hearing and what you know these people are experiencing?
Oh, absolutely. And I am so happy to be talking, especially this week, with National Infertility Awareness Week. This is the only thing orange I could find in the house to put on for it. But it's the organization Resolve does so many wonderful things with this, and the support community that's available, I think, is profound. So I can't underscore that enough. And I'd like to just refer back a little bit to what the doctor was just saying. And that is that your fertility doesn't change in a couple of months. And I kind of get tears in my eyes as I say that, because women are struggling with that, and families are struggling with that in their family building process. And also that it's a wonderful time to kind of do your consults online when you're trying to figure out which doctor or which clinic to go to. It's a great opportunity to make a couple of appointments and talk to a couple of clinics and see which one has kind of the milieu that you're most comfortable with. What I'm finding is that this weight is now self-imposed. And that's a really hard thing that people are struggling with. Women are struggling with it, and couples are struggling with it, or somebody has a partner, their partner is struggling with it. Because many times, which, we know, so I'm kind of stating the obvious for some of us, and I apologize for that, but we know that when people go through a fertility journey, it takes a while to realize that maybe there's something not right. And then it takes a while to accept that maybe there's a diagnosis associated with that, because infertility is a medical diagnosis. It's not, but it's one that we don't expect. So when these things happen, sometimes we start to blame ourselves for waiting too long. And we start to feel a little bit ashamed, or a little bit embarrassed, a little bit of anger, a little bit of frustration. And I'm sorry I'm naming these negative emotions, but at the core of all of them is hope. And there's a belief that we're going to have our family. And I do think everybody can hold on to that, because you all will have families, or at least almost all of you will, depending on the way, shape that family takes. We don't know yet. But that dream can come true. It's just a matter of how it comes true. So at this point, when you're first starting and you've waited all this time to decide to go to the doctor or to a clinic or talk to your OBGYN, whichever part of that process you're in, I think it's important to understand, if you start to question that wait, why you waited, because there was a reason for it. We didn't just wait for no reason. There was maybe a financial reason, maybe there was an emotional reason, maybe there was family that needed some assistance, maybe there was a trip you wanted to take. But please try and be cognizant of what you were feeling and what you were thinking that created that weight, so that we could stop some of this negative self-talk of blaming ourselves, because that doesn't get us very far. And so I encourage people to try and do that. And there's exercises we could do if we catch ourselves going down that roller coaster of just blaming ourselves and kind of getting caught up in that. One of them, if you don't mind, I'll share very quickly.
Oh, yes, please.
Okay, great. It's called STOP. It's one that's been around for many years. Some of you may have heard of it. And it's actually exactly what it says. It says when you start to feel yourself spinning, you start to feel yourself a little anxious, just stop. And if you can stop your breath, do that. So the S in the STOP stands for stop. Just totally pause. And then the T stands for take a breath. So now just take a little bit of a breath and, alleviate that stopping, which could be calming. And now the O stands for observe. So observe what's going on. Observe the circumstances, observe your thoughts, your feelings, and look at all these things that are kind of like floating around in your head, and come up with a little bit of a perspective or purpose or plan for the P, and then you can take action. So the acronym is STOP, and it's to allow you to just reflect for a moment and take a breath. I think it's a good one because it's an easy one to remember. One of them I use a lot also is just pause and perspective. They go hand in hand. So while you're waiting, I really encourage people to look at what's going on and to empower themselves through understanding.
And that is really fantastic, not only advice, but just observations. I had not really thought about that kind of self-blame of people who may have thought that they've waited too long. And, no one could have predicted this pandemic and
oh,
what,
goodness, no.
And what kind of impact it would have. And yet there's some really powerful things that can come out of this in terms of their movement forward and so forth. So thank you so much for that advice. My slides are just moving around here. Let me just ask both of you, and I'll go back to Dr. Klipstein, if you would, thinking about this community, thinking about those patients that are right now probably in the midst of also infertility care. There's a lot of uncertainty, a lot of questions. Is there a place where you would suggest they go to kind of get information? How will they know when clinics start opening up and so forth? What's the process there for people?
Yeah, thank you. That's critically important. And first of all, Barb, let me just tell you, thank you for all the work that you and Resolve are doing. I think it's so helpful during always, but even more so at a time when people just don't know where to go, and they can go to your website and just get so many wonderful resources. In terms of, there's a lot of uncertainty. The American Society of Reproductive Medicine, and you can go to their website and look. We have been publishing on a regular basis updates, and so that's helpful. There will be another update at the end of the month, and we're all looking to find ways to safely and gradually open up our fertility practices. All of the fertility websites, also just the individual practices, most of us have information on our website, including blogs, including information. And you can always call and I would say most of us have at least a place where you can call. Someone will answer the phone and tell you what's going on. The CDC is a good place to go because there's really updated information on what's going on in terms of the level of disease and recommendations for staying safe. So I would go to all of these places, but rest assured that all of us behind the scenes are talking about how to best and most safely open up our clinics. And we really, none of us want to be here. I can tell you, all of us fertility doctors, it's very hard for us to sit at home, see our patients struggling, want to get those, cycles going, want to get our patients, pregnant and help them in any way possible. And it's just very difficult, want to hug our patients, and we just can't do any of those things. So we are working really hard behind the scenes to try and do what we can to, restart the country like the rest of us. So.
Absolutely. And I get a lot of the emails from the medical societies and from others. And I know there's just a ton of internal training going on, how do we restart? How do we reopen? And I know all of you are working extremely hard to determine the best way to do that and learning certainly from each other and other experts. So we are so appreciative of the physicians, your nurses, your embryologists, your front office staff, financial team, and of course all the mental health professionals, whether they're in-house or in private practice, that are helping people right now. Lori, let me just turn to you. Is there anything else that you would like to share with our audience?
Well, there's just a couple quick things. I'm sorry, it's getting very dark in here because it's starting to rain, and it was very bright 5 minutes ago or 10 minutes ago.
You look great. Everything's good.
I wasn't sure if there's like this dark shadow, so I apologize for that. But there's a couple of things just quickly if I could share. And I think that what we want to start to do is empower ourselves during this wait, because it's really important. And you just shared all this wonderful information about knowledge and places to go for the knowledge. And we want to do that. And I think through empowerment, we need to obtain knowledge, understanding, and a plan. And if we could do that through accessing the resources like ASRM and like Resolve and the others that are reputable, I would really encourage people to do that. And in understanding what we're experiencing and what our plan should be, I would encourage everyone to do that through talking to their partner if they have a partner, and coming up with a plan through communicating and compromising. And then the other thing is, and I know people have heard this many times, but there are support groups listed on Resolve. There's peer-led support groups and there's professionally led. I'm so happy to be leading support groups at this time. And also there's friends that you can reach out to. Just please know the friends that you're reaching out to and know what they're capable of sharing and what they're not, and what you're comfortable sharing and what you're not, because there is such a thing as wanting to be private. And sometimes what we do is we make feeling private into making us feel like it's a secret, and it's not a secret. Some of these things we just want to keep private. So if we could become comfortable and embrace the difference between the two words, I think it's very important. And one last thought, if that's okay.
Yes.
And the last thought is, I was talking to somebody who's very dear to me yesterday, Dara Godfrey, who actually specializes also in fertility and nutrition, and her husband, Jay Godfrey, has this wonderful thing that he does now. And there is, as we all know, this verse that says, do unto others as you like others to do unto yourself. But he shifts it. And what he says is, do unto yourself as you like others to do unto you. And what I'm trying to raise there is the caring and the nurturing for yourself at this time. And
yes.
your partner.
Yes, great advice. Take care of yourself. There's lots of, I even for myself have found a lot of comfort in some meditation apps and some other things that I think we all are appreciating right now. Go ahead, Lori.
Oh, and I'm sorry, I didn't want to cut you off, but the other thing is, I had a list, I just wasn't sure. The other piece of that I think is really important is if we can all find something, and I don't need to sound cliche, but to have gratitude about. So even if it's just that one woman said to me this morning, her cable is working, something, maybe there's a piece of chocolate in your cabinet that you didn't know was there right now because we can't get out. But if we can find a couple of things before we want to go to sleep to be grateful for, because sleeping is being interrupted now and it is hard because there's so much going on, that could be helpful.
Wow, what great advice. I just want to thank you for mentioning.
Can't hear you.
I am muted. Thank you for that so much, Lori. I want to also thank you too for mentioning the support groups, because we do have a number of support group options at Resolve. Most of our in-person, well, all of our in-person support groups have moved to virtual. And then we're also trying out some nationwide virtual support groups. And we did that a few days ago and it was really successful. So even if you have never been involved in a support group, boy, now is a good time to try that. I want to thank you both so very much for joining us. If you're trying to conceive and it's not happening as quickly as you hoped, remember you're not alone. We would love to have you reach out to Resolve. Our website is resolve.org, and we hope you have found this information helpful. I want to thank you both, Lori Metz and Dr. Sigal Klipstein. So nice to have you both, and appreciate your wonderful advice and expertise. Thank you.
Thank you.
Thank you.